Hey guys, Don here. Welcome to Podiatry Practice Mastery, where I'm going to help you get your practice to the $1,000,000 mark and beyond. I'm going to be sharing kind of what worked in my day here. This is a recording of a Monday in my clinic. Kind of the most challenging aspect was that there was a patient last week, Thursday. I always like to talk about the good, bad, and the ugly. This is a patient that had a kind of an IPJ wart, and I did Cantharidin on it. Older gentleman, and it blistered up and it got infected, and he had like cellulitis, and he showed me a picture. They sent me a picture because I was on call over the weekend, and I had him go to the ED. So it's a little concerning. I've never had that with a Cantharidin before. I know it's kind of a powerful blistering agent, but that was the first time, so you kind of lose a little sleep about things like that. So that was kind of the bad thing of the day. Now go into the day here. So first patient, she was a 55-year-old female that has some chronic insertional Achilles tendonitis. We've already done 6 treatments on her bilaterally. She is a neighbor, so what I'm seeing her now is once a month to do another 3, focused only, and I'm not charging her. I'm just charging her an office visit, just because once it gets past the 6th mark, it just gets kind of prohibitively expensive in my opinion. That's probably my opinion, not her opinion, maybe. But anyway, that just kind of let you know how some patients, I'm just doing office visits for stuff like that when it gets to be a really high number of the shockwaves, and sometimes for Swifts as well. Next was a 13-year-old that had an IND on the left hallux. Next was a number 6 out of 6 for plantar fasciitis. She's already like 50% better. So I'm going to see her back in 6 weeks, and I did an office visit because it was the last shockwave. I find that using these little paper handouts I give them for like the last shockwave as well for my nail fungus, it really helps me to be much more concise. So I'm trying to figure out one of those for my plantar, like heel pain, Achilles and plantar fasciitis. I think it's going to make it a lot easier, where you can cover a lot of ground a lot quicker, versus like talking about everything. And if it's just like a set plan, it works a little bit better. You might not follow that plan every time, but for a lot of patients you do. Next patient was a 56-year-old female. She had an old fracture of a 4th digit that healed, and then it started to have pain again. On the MRI, it showed bone marrow edema in the proximal phalanx only. So I'm going to call that probably either a delayed union or just an injured 4th metatarsal, or I'm sorry, 4th digit. So we're going to do 6 sessions of shockwave for her to help calm down that bone marrow edema, because it's been a number of months, about 6 months. She's been having pain, and her toe is very swollen as well. So that I thought it was originally possibly like an osteo, but it just came up with bone marrow edema in there. So that's a good use of the focused only shockwave. Next patient is a 73-year-old. She had a left 2nd intermetatarsal space neuroma, so we did an injection with ultrasound guidance. Next was a patient that came in for bilateral cariflex, and she got a kit. So I'm trying to give those to Marjorie, my nail tech. Not working so well. So that takes me a little bit of time to do them to make it look good, but she's going to be happy with that after. Next was a patient that had a skin rash on the lateral foot, so I did 2 2-millimeter punch biopsies to determine what it is, either eczema, dermatitis, or tinea pedis. And so then we're going to see her back in 2 weeks to go over the pathology and then give her the medication. Next was a patient, 54-year-old man. He had some white discoloration on the proximal half of his nail. It did not seem to be superficial white onychomycosis, because I couldn't scrape it off with like a curette. So for this one, I gave him Formula 7 and then the biotin to help the nail grow out faster. I'm not totally sure it's that, but I couldn't really take a sample since it was the proximal half of the nail. Next was a 55-year-old, number 5 out of 6, for shockwave for this patient on his sesamoid. So he was having sesamoid. He did have uptake on his MRI on both sesamoids, but the tibial one is the one that hurts more, so I'm focusing more on that one. So number 5 out of 6 for that. Next patient was a 59-year-old that had pain previously for plantar fasciitis. Now the pain is more in the FHL. Gave a prescription for PT for that. Did an ultrasound, and going to see the patient back. If it's not responding to PT, then we're going to do shockwave for this patient. Next patient was a 59-year-old. We did a nail sample, and we did x-rays and ultrasound just for his feet as well. Actually, at the follow-up, we're going to do x-rays bilaterally for him. So he's a new patient, diabetic, kind of really swollen. They had concerns of cellulitis, but he had kind of nail fungus and just kind of a high A1C and some foot issues. The x-rays didn't show anything. I don't think they're going to show anything, but I'm a little concerned for him for having kind of a neuropathic foot. Is there any beginning changes of Charcot or anything like that in his foot? Next was another Cariflex with a kit. And next was a patient with dorsal second MPJ pain. I did an injection just dorsal to the capsule. I don't like to go into the joint because of the joint weakening, but we did cortisone just dorsal to that with an ultrasound guidance. Next was a patient that was referred over. She was a 41-year-old runner that was preparing like a couch to 5K. She was referred from her running coach / PT, and she had posterior tibial tendonitis, recommended foam rolling for her, and also just wearing more supportive shoes at home. She's a mom of 3 and tends to be barefoot most of the time and running around after those kids. Next was a 28-year-old that got an IND for an ingrown toenail. Next was a 76-year-old that had a cortisone to the right, first MPJ, had a painful kind of joint region, and he had some concerns of possible gait abnormalities. He wanted to try an over-the-counter insert first before the custom ones. Next was a right base of the proximal phalanx fracture, intra-articular. This is a good one, just so you know. This one I made a video for, so I can put on my website for our kind of focus on getting urgent care patients in, or like a same-day podiatry urgent care. This one went to the urgent care. They didn't have an x-ray there. They sent them somewhere else that did the x-ray, but they didn't have a radiologist. And then they sent them over to us, and we found this intra-articular fracture. So that's like a video that I did, so I can put that on our website to kind of get patients to come here directly. It would just make it a lot easier for them. Next was a number 3 out of 6 Shockwave. This is a patient that's doing Shockwave for his Achilles insertion every 3 days, every 72 hours, because he's going to be traveling and just wants to get him done quick. And this is also a guy I did an ingrown toenail on, but I noticed that it swelled a lot on the edge, and it kind of grew in a little bit. And so I was having him try to tape down the edge, but I don't think it's going to work. I'm probably going to have to numb it up again and take out a little bit more nail. That's always frustrating because I try not to take out too much, but when the nail edges swell, it makes it a little bit challenging. And then last patient was a fungus lamisil, where I didn't do a nail sample, so she just wanted to get right into the treatment, so I put her directly on the lamisil with the kit. And then she also had a little bit of neuritis. She had a chiropractic adjustment to their anterior ankle, and the nerve kind of got inflamed. So I recommended cross-frictional massage, some lidoderm patches, heat, and I even recommended gabapentin, but she didn't want to take it. She's just going to give it a little bit more time with anti-inflammatories for that one. Okay, so that was the day in review. Once again, I hope you guys find this beneficial. If you want to learn more, I kind of put everything into what I call the $1 million, I think it's called the Practice Blueprint. It's right on our podiatrypracticemastery.com. If you haven't looked at that, I kind of put it all in one place for you guys to see how you can kind of scale your practice to the $1 million mark and beyond. Okay, guys, if you have any questions or thoughts, shoot me an email, don@podiatrypracticemastery.com. That always gives me new comments and new ideas for this podcast.